Now let's talk about striking nurses. Leadership of the nurses and midwives have entered into compulsory arbitration with government as they seek to resolve the standoff over their conditions of service negotiation. The nurses have been on strike since Monday, leaving many patients stranded. This afternoon, JoyNews is learning one person may have been dead or one person may have died. We'll bring you details of that shortly. Before that, though, details of how the strike is impacting healthcare delivery on the ground. Manuel Kranting has that for you. He's been to the Kanishi Polyclinic.
Workload has reduced drastically. I would say we are only operating to about 5% of our full capacity as at now. Currently, if I should take you to our reception, the place is completely empty. Previously, or let's say last week, if you should come around this time, you see a whole lot of clients waiting. Some waiting for their services to be given to them, or waiting for their results to go back and see the clinicians.
But how many tests have you conducted in the past 3 days?
Monday, the whole day, we had only 6 cases. Monday, we had only 6 cases. Yesterday, we had about 30 cases, instead of our average of 150 a day. As of today, we have only 8. Currently, we are considering downsizing the staff strength per day, because they will take transport and come here, not do anything, waste money, go back. So considering downsizing the numbers from tomorrow, if the need be. It is my prayer that government will heed to their request and grant them their request so that they come back to work.
While in the northern region, the pressure is mounting on private health facilities to take on all those turned away from public facilities. At the Kapsad Scientific Hospital in the northern regional capital of Tamale, all their beds are full and there's no space to accommodate more. Hospital Administrator Constantine Way told JoyNews most people come in critically ill who need to be admitted, yet the facility is full. She is calling on government and the nurses group to find an amicable solution to the crisis to stop the needless deaths.
What the numbers are this time around. The numbers are really going up. I think it's all because of the strike of the nurses and midwives and other health people. Even though the peak season is drawing close to an end, but the numbers are keeping on going up. And each day in, we have people coming in. To the extent that our beds are all full. So now we can't even admit. And the cases that are also coming, most of them also demand admission. And we are limited now. So actually, it's giving us pressure. Some of the cases will come, you look at the person, you cannot admit. You can also refer to a bigger hospital like the teaching hospital. So now where do we go from here? What do we do? So I don't know. We in our own small well in Kapsad, we are trying to see what we can do for the patients. Those that are not too sick, we see them on OPD basis, then they go. Those that we think needs to be admitted, we advise them otherwise. Either to go to SDA or to try the teaching hospital if it's an emergency case. Unfortunately, let me just say, the strike impact has started hitting, because we just recorded a death case this morning. The woman came yesterday, was seen, and then asked to do an X-ray. She was rushed in this morning, and within a space of 20-30 minutes, the woman had died. If the teaching hospital was working, that would have been the referral place. But unfortunately, we couldn't refer, and we did what we could, but the woman still died. So currently, as we speak, the woman is still in the facility. The dead body is still in the facility. The relatives have gone to see how they arrange to pick up the body to the teaching hospital, to the mortuary. So the strike has started hitting For us, it has just started. Today is the first case we've recorded. We don't know what the days ahead will be like. So, for CAPSAT, we think that government and the people involved, the striking nurses and midwives and the others, if they can quickly have their meeting and then go to the drawing board, get a conclusion to this problem, it will solve a lot of things, because at the end of the day, it's the patients, the citizens that will suffer. You get it? It's the citizens that will suffer, because if they are not working, then this that has started happening. I don't know about other places. Maybe it has since Monday. Maybe other places it's even more. You see, is that what we want?
Thank you, sir. Your full name, sir?
Constantine Transin. That's my name.
And you are the
administrator of CAPSAT Scientific Hospital. Thank you.
Martina Bugri in that conversation with Constantine. Well, we can go live to Martina right now for more on this. Also online with us our other correspondent, Anas Sabich from the Bono East region. Martina, it's good to see you. You've been interacting with this hospital, and which says that they are beyond their capacity at the moment. Give us a mental picture of the situation at the moment in Tamale.
Now, I have been to that hospital before. I've been to the CAPSAT hospital before. Normally, when you go, it's not too busy a hospital. There's few people come in and go. But today, when I entered there, from where people park their motorbikes and enter into the facility up to the OPD, and any space available in the compound was occupied by people. And I'm told it started from Monday. Once they declared the strike action, people started coming in, and it has been so from that day till today. And so announcing that the strike is over definitely is going to be a big relief for the people of the metropolis.
You talk about the fact that this is a very less busy hospital, which is now almost choked. Yesterday, you brought us a story about the woman who came all the way from the Volta region to seek help. Is there an update on her? And was she one of those who went to this hospital?
No. When I went today, I actually sought to find out where they were, and I was told that they were not attended to, and so they had gone back. I hope that when the strike is over, they will return. But that also means that they'll have to book another appointment, and when it's approved, they will return. That's what it means.
For the nurses who are on strike, I mean, today we've heard that they are going into compulsory arbitration, etc. Have you had the chance of hearing from any of them at all, or interacted with any of them at all?
I spoke to the public relations officer of the Tamale Teaching Hospital, and he says that whatever decision their nationals would take, that would be the decision they would implement. So if they call and say, go back to work this minute, they are going back to work.
I see. As we speak, though, nothing has happened, you say?
Nothing has happened. Yes, I was at the TTH around 12. The place was eventually empty. Nobody was there. Those who think they can afford are beginning to leave. Those on admission, some are beginning to leave to private hospitals.
Okay. Martina, thank you very much. Anas Sabit is joining us from the Bono East region on phone. Hello, Anas. Okay, Anas is joining us on Zoom. Anas, has anything changed? Yesterday you told us how everything has come to a standstill in the major hospitals that you mentioned, you know, the Holy Family Hospital, the Islamic Hospital. Has anything changed?
Not really. Today I decided to go to the other side of Techiman, which is the Techiman North district. The district entirely has 14 health facilities. 11 of these are under government, that is 5 health centers and in 6 CHIPS compounds. Now, a number of these CHIPS compounds were closed down today when I went round, I saw the Chidiaja Chips compound precisely has been locked down because the few staff over there are all nurses. So there's no coming to open and then leave it out there without anyone around to take care of it. Apart from that, the Subinja Health Chips compound was also closed down entirely. Then I went to the Chewadom Health Center, which is the largest health facility in the entire district. That is the Teshima North district. Over there, I met a number of patients who were there to seek for health care, but there was no single nurse, no single midwife, and then the PA who is supposed to also be there was also not on the grounds. I only met some few finance officers and the other hospital staff who were there, were unable to attend to this patient. So it's worrying in the Teshima North district, for instance, because almost all the health facilities in the area, 11 out of the 14, are all under government, and all these facilities are not attending to patients because the entire district is without a single medical doctor. So it is either nurses or PE who are taking care of the patients within the district over the years.
Anas, thank you very much. I guess that if anything will happen, we'll get to see some results tomorrow. Anas Sabi joined us from the Borno East region. Well, this morning, the nurses announced a suspension of the strike, but they say they'll only return to work tomorrow. Here's National President of the association.
In the face of the injunction, our respect for the courts, coupled with our innate passion to serve our patients and clients, and for that matter, the good people of Ghana, we have decided to temporarily suspend our strike action with effect from Thursday, 24th September 2020 at 8 a.m., pending the outcome of our negotiations. For the avoidance of doubt, we wish to indicate that the strike action is merely suspended, and our gallant nurses, midwives, PAs, and CRAs are to begin full work on Thursday, 24th September 2020 at 8 a.m. with the morning shift.
You can trust us to be there in the morning shift to find out what is happening. Well, we also know that negotiations between the nurses and government at the National Labour Commission has resumed. So we'll keep our eyes on that and bring you more.